It's in 223. You want me to pull up directions? I'll read you the notes in a second.
Oh, yeah, there's a temple located in the area.
So we have been dispatched to a trespasser unwanted at a residence. Being a social worker, you know, we're always agents of change. I cannot imagine being anywhere else, doing anything else, because it just is doing good work, and it's doing something that actually addresses systemic concerns, systemic issues. You know, people all over the world have been crying out for, we need something else. We need an alternate solution than just police, than just EMS, than just fire. We need something else. And this is that something else.
Everyone, Ryan Smith, I'm the director of the department, and these are always great happy days for me. I love welcoming new people and continuing to get to know some people better. Our department was created July 1st of 2021, and I want you to know a little bit about why our department was created.
What do you want? When do you want it? What do you want? Justice! When do you want it?
The Community Safety Department was born from protests and the feeling that police officers could no longer do the work that the community needed for them to do.
There was a lot going on in the country, a lot of uncertainty. Right in front of our own headquarters, we had defund painted on the road for quite a while. Folks felt that maybe their jobs were going to be replaced, if you like.
Always created the narrative that individuals will become.
There was concern that in starting a new public safety or community safety department, it would actually dilute resources that certain residents in the community felt should be added to on the side of police resource.
A lot of the early work before we had programs or pilots was sitting with residents, facilitating conversations with community partners and people that were already doing this kind of work. We didn't want to paint the canvas. We wanted to really understand what people were feeling and experiencing.
We soon removed that fear from our community. When they actually saw what we proposed and what got approved, they soon began to realize we can have both.
We wanted to better understand 911 calls, why people call 911, what are the outcomes of those calls. We ended up working with RTI to do an analysis of 3 years of call data.
The research team looked at over 1 million calls. That research let us know that the majority of the time when folks are calling 911, often it is not a response that needs an armed officer or it's not a violent response. It is just a neighbor or a resident that needs assistance.
Police officers are trained for law enforcement. Having a crisis or being in need of services is not criminal. There has been such an increased need for mental health treatment, but treatment as it starts at ground zero.
If it is a violent crime, we understand that it needs to be a police officer. If it is not that, then what are the other tools, what are the alternatives that we can send that you're going to feel safe and we know your need is going to actually be met?
The data work that RTI did, it started there to determine what calls would be eligible for our different various pilot responses. And the data will continue to be very important in evaluating our work as we move forward.
We decided to create a whole new response that was compassionate and a response that could be sent out to a resident's crises that had its own identity. So we decided to stand up a new department and we named it Community Safety.
almost a year later, we started our pilots. It took that much planning to figure it all out. On the week of June 27th, we launched 3, our crisis call diversion program. We put our first clinician in the call center. We had our first unarmed response team go out, our 3-person team, which is a clinician, peer, and EMT. And we started care navigation, though that wasn't fully staffed yet. Last week, we started our 4th and final pilot, co-response, which puts a clinician with an officer to respond to calls where there may be higher indicators of like potential risk. This is not just about that history, but it is an invitation and welcoming of you into that history. We are all part of a common story now, and I really believe in this work, and I'm just excited for what together we can do to help reimagine some aspects of public safety. What about you?
But why I believe I'm here is because of my experience. Our neighbors, I've been homeless. I've slept on church benches. I've slept in the streets. My experience is a valuable asset in supporting them with having their needs met.
That is real expertise, and people that we can't do this work without are what we call peer support specialists, and it is so crucial to this work, and I'm just really grateful for it. And
I came and checked and made sure that we had some. I've got a tent for you.
Okay. All right. Thank you. This will help too.
The role of the peer support specialist is one that is able to rapidly cross that bridge between the two people. To give an example of an occurrence that happened earlier today, one of the individuals was expressing a lot of frustration. He looked at me and said, "You've never been where I've been. You don't know what it's like out here on the streets." And I said, "Well, I've never been where you've been, but I used crystal meth for 17 years. And it brought me to some really dark places." And he stopped and he looked at me and he said, "You do understand." And his whole demeanor changed. And we began to have a different conversation.
As we started interviewing and looking for amazing people to be a part of this team, it kept being a kind of phrase that popped up. People in their interview would say, "I really have a heart for this." Or we would be doing reference checks and someone would say about the person, "You know what, they really have a heart for this." We thought about the kind of people we were looking for who had a heart for this, and it ultimately became our name for this work in the community, Holistic Empathetic Assistance Response Team.
It's easy to be a clinician, right? It's easy to think about and conceptualize and theorize in a framework of a clinician, but a lot of times people don't need a clinician, right? They just need connection. They just need to feel a sense of safety, a sense of validation, a sense of love. We kind of shy away from that word love, especially in a professional setting, but that's what we do. You know, it's love is what we do, is what we give, and so.
Before I saw the job application, my sister passed away. And she had a lot of struggles. She also had some justice involvement. So I think after looking at the job description, what kind of kept coming back to me was I wonder if things could have been different. If there was a different response.
EMS 51, copy. Medic 24, Medic 27, you both can clear. 511 to respond.
The weapon is going to be a belt.
Throughout my years in 911, I personally saw the need for alternative responses. I, as a call taker, can remember multiple times where I was on the phone with someone who was pleading for help, number one, but two, they were pleading for me not to send the police, but that's all I could do.
When somebody calls 911, it automatically goes to a call taker who is trained. They have a protocol that they have to go through. Maybe it's a mental health crisis, suicide threat, any of those things falling in the scope of what I do as a clinician. The call taker transfers the call to me. Hey there, good morning. My name's Jordan. I'm a counselor in the 911 call center. I speak to the person, I get more information. I'm able to ask those questions that maybe the call takers wouldn't think to ask just as a licensed clinician. Were you in the hospital recently? Were you on any medications? Have you ever been hospitalized or gone inpatient? When's the last time you've had an episode like this? And once I've gathered that information, I am the person who determines what response goes out. So that might be CRT, our unarmed team, if there's no weapons involved, or if there's more of a high risk to that call, then I would send co-response, which is the clinician and law enforcement.
One of the most important things for our public safety responders is for them to have a connection to the computer-aided dispatch at all times. It's a two-way connection, not only for our responders to receive the notes and the information on the call that they have been dispatched to, but also for the dispatcher to be able to see where they are at all times. They know in this case exactly that they're on Highway 55, Apex Highway, right here. So if that unit was in trouble, didn't know exactly where they were, or needed help, the dispatcher would have their location at all times.
Stay in the right lane.
The notes in CAD state that the caller says that they got into an argument.
To turn onto North Roxborough Street.
I got into an argument.
Carolina Highway 90.
I want him removed from my house. His name isn't on the lease. I guess where that red truck is.
The destination is on your left. Arrived.
All right. Let's do it.
When you see the Post-its, one, there are a couple things I want you to always remember about what it means about this department. It is a testament to our commitment to collaboration, that we are all doing this together. We don't have doers and planners. Like, we are all of us fully own, and I want you to feel responsibility and from that a sense of pride and care for building this departmental culture and figuring out what our pilots and responses like they need to look like. And it is an invitation for you to participate. That these are like canvases to work on. These are ways where we want you to be capturing and helping us make sure that we're not missing important things. There are places for you to note your questions, your resource needs, your insights and ideas for things, ways that we can do this work better.
I was very appreciative of our team. And I was like, this is what we do. And when people need to tap out, because I need to tap out. And, people were able to step up, and I was glad. I didn't have any concerns that the matter was not going to still be handled with grace, and everything. But I was just like, I'm tired, I'm hungry, you know what I'm saying? I need a nap. I love y'all, thank you. Yeah, thank you.
I would love to celebrate Kiata and a co-response call we went on. There were so many officers there. There was probably like 8 officers. We got there and the neighbor asked to talk to Kiata, and she just went up there and was like, come on, we got to go to the hospital. And he just got up, got his shoes, walked right out the door. We stayed with them, and it was a really, really cool experience.
Yeah.
Okay.
All right, so we're gonna do down dog. If you're gonna.
The culture is just loving and filled with just kindness and acceptance of where you are that day, which I think we really need in the work that we do, because it's really easy to burn out from this work. Being in an environment that's supportive of that and honors all those challenges and isn't afraid to talk about them is really important, and that's what we have here.
As we were planning the department and we were referring to the people who we were going to serve, we really struggled with a lot of the words that were being used. I think those words are entirely appropriate in other settings, right? Patients, clients, consumers are some of the words. We are a public service entity, and we feel very strongly that we are accountable to the public. We believe that everyone we encounter, regardless of background, is noble, is worthy, is dignified, and we try to treat people that way.
I can't remember specifically who it was that came up with the term neighbor, but we all heard it and it just kind of clicked. Our neighbors need support and help. We're all just, a couple of bad days away from needing the support and help from our neighbors.
Being a single parent, it's not easy, it's hard. I know a lot of single parents out there, parents, period, that's probably going through the same thing I'm going through.
It's a whole bunch of substitutes.
Oh, wow. Trying to take care of your kids, keep food on the table, the lights on, rent on, school, and work at the same time. It's a lot of pressure. At the time, I was going through a lot. I didn't know who or what to do, I was mentally having a breakdown. But the HEART program, and I feel like I'm about to tear up right now because of my testimony, They came in, they got my information so that my rent could get paid. They saved my life. Sometimes you just need somebody to talk to you, somebody to give you a hug or something, and they do all that,
Care navigation is recognizing that if we want to connect people to the care they need and want, it's going to take some additional follow-up. So we send a team to meet with them, maybe meet with them multiple times, not to provide long-term case management, but to get them connected to the care they need and want, other community-based care.
We are here to serve our neighbors, and we also are, wanting to be in this space of safety. However, I do not feel that any of us will ever put us in a situation where we are unsafe and remain.
We were dispatched to a call that the previous day it was domestic violence. Okay? I was scared shitless. And it pissed me off. Yeah. I'm being very honest. I want to help neighbors. I'm in recovery. I love my life. I love who I am, and I want to help people get there. We cannot do that if we're afraid. And I have absolutely no ounce of shame saying that I was scared shitless yesterday.
Thank you, Christopher.
I'm
Thank you. No, thank you. That's what we want. Thank you. Okay?
It's important to remember that, one, you always have a choice in every situation. Just because we're dispatched to a call, if you don't feel safe going, you don't have to go to that call. You can wait for Peter. Yeah. We shouldn't think of ourselves as the answer to everybody's problem, because we're not. And we're not always the right response. Even if we get dispatched to a call, if you feel like we're not the right response to it, you can call communications and say this requires an alternate response.
Anytime there is a call where someone felt like they were unsafe in that call, that's an important moment that we always have to debrief from that. All right.
Appreciate you.
When I think of the word safety, and when I have been probed about my thoughts on safety, I go back to my foundation. I'm a social worker. Social workers have been doing this work for hundreds of years without guns, without weapons, without batons, without all of these other things. And so when people say, oh, are you, fearful, or what about safety? No, I'm not. I'm not scared. When I start being scared of the people I work with, I no longer need to do this type of work.
Hey, I'm Jessica. We haven't been formally introduced with community safety. Do you have someone who's coming to get you?
Well, I'm trying to, my sister's trying to talk.
Chill out. Yo, you need to relax. You need to chill. You need to relax.
Stand out here with us.
I'm trying to stay calm.
How you feel? Come on.
He's in the ignorance.
Go outside.
We're in our house. Let him go out.
Can go from 0 to 60, you never know. And the young man actually requested police.
Okay.
And we can, that's the push of a button. We'll just say, CRT1, best police presence. And that 2 responded, so.
We approach this work as community safety being a fourth arm of public safety. All of our responders carry public safety radios to where they can radio for help, they can radio for backup. They carry a tablet in the vehicle to see any alerts or flags on that address, and the dispatcher has that location of that vehicle at all times.
So disturbance call, 20 current calls active, 10-4 en route. There is always that nature of, am I safe or am I uncomfortable? And I feel like if it's an uncomfortable feeling, exploring why is this uncomfortable and not really operating off of that place of fear. Now we are responding to a domestic violence call where the caller wants to put her husband out of her house because he fights all the time in front of the kids. So right now we are staging with the officers prior to arriving on scene. So I'm gonna ask. Normally at a staging, we will communicate, like, if they have any background information or something that I should potentially be aware of. You know, obviously they're gonna assess the scene, make sure it's safe, and then we will further engage. But as you saw, that didn't happen. We weren't even at the door yet. Next thing I know, they just turned around, was walking away, and I had to ask him, what did she just say? I would have appreciated a situation where the officers say, so we have Hart here, and there's a clinician on the team who can further give you further resources if you would like to talk to her, further engage for more support, you know? But it was just a matter of, oh, he's gone, all right, bye, you know? Some of the interactions with officers are good, some are not so receptive. I just think it's just gonna come with time, with some officers to like get on board with what we can offer our neighbors and how we differ.
We're very territorial. We view our role as a calling. When there was kind of this conversation of taking from the police department and creating the community safety department, initially that was met with a lot of pushback from officers and community members alike.
If we were to start over, what would we decide police should be doing versus not be doing?
People are going to do what they think they can get away with doing. That's what depolicing is.
One officer says the city does not have their backs.
In media, it has been portrayed as you have to be on one side or the other, but we can do this together as a team and we'll be more effective that way.
We're here to help the situation and not necessarily replace or be at competition with each other. It's just there are different things that each person can contribute.
Those that viewed the community safety department and Hart's role within the city of Durham as a hindrance to law enforcement, we have been doing this long enough to show that there is never going to be a hindrance, that we are a partner. And I would say to those folks that really doubted that to take a second look. Think about how you would want to be helped or assisted if it was your family, your loved one, or even yourself. Who would you want to be coming to that door?
Right now, the situation's pretty calm. The neighbor who's trespassing a whole lot, he's packing up his belongings.
Just found out yesterday.
Yeah.
My kidneys is decreasing, and now this.
Yeah.
It's a lot.
Yeah.
It's a lot.
Yeah. I'm so sorry you're going through all this right now. This place right here, okay, they can help, like, filling out information and everything like that.
Everyone is safe.
Yeah.
That's really the bottom line. Everyone.
Yeah, we separated people when they needed to be separated, and we stayed in communication and checked on each other, which is always important.
We spend a lot of time thinking about and assessing our programs using data, right?
One of the core foundations for community safety and what we do is data. And the data continues to be very important, and pulling that data from the CAD system and the 911 call data to see where our responses will be most appropriate and most needed.
We report out to our city leadership every 3 months, I want to say. And essentially, there are 3 sorts of buckets. The first bucket is very traditional public safety sort of questions, right? The second bucket is connecting people who are in crisis to the right care, right? And that's specific to sort of the follow-up and care navigation spaces. And then the final thing is very, very relevant to you all in particular. We want to know how many of our unarmed responses resulted in calls for police backup for emergent situations, right? That's an important number for us, because if we're getting a bunch of calls that do result in PD backups, then maybe we need to reconsider some call types.
Data is very important in the work that we're doing. In order to have balance and harmony, you have to have the analytical and the quantity. That data brings that analytical piece. It allows you to see numbers, to have officers reaching out for us, to have the fire department reaching out for us, to have EMS reaching out, to have different community agencies saying, how can we get HEART to come? It can show since the beginning it's gone up.
All right, so we're headed to trespass call at the Burger King. Looks like 1 male, blue jacket, pants, white hair or gray hair. Might be unsheltered.
Very nice. You staying warm at night? You got a hat and everything?
As we've progressed, officers have seen this was not an attempt to take from the work that officers are called to do. This is supporting that work, just as we support the work that Director Smith and his team, they are doing as well.
We wanted to try to get you to open table, see if you could get you some clothes.
The most time-intensive calls that we respond to are actually now being supplemented and helped by the Community Safety Department. That allows officers to focus on violent crime and addressing some of the other ills within our community. What's important is that we are having the debriefs and we're having the very upfront, frank conversations, learning from each other, and that will never stop. No matter how good we might get at the co-response portion, there's always going to be some things that we can make better as a team.
I'm basically a backup officer, just like any other patrol car would be. I just happen to have a clinician with me. We've had to evolve with expectations. If you look at a McDonald's menu from 1980, you have a burger and a cheeseburger and fries and a milkshake, maybe. Now we've got, a whole lot of other items on the menu because that's what people want, number one, and also there are some healthy options because that's what we kind of need. It's kind of like that. We need more options out here. As a whole, we've been, I think, very, very well received. And we've had some really, really good results to back up that it is a needed resource.
We're gonna dive in. If there's a positive story, if there are any challenges that you're experiencing that you want to lift up, and then opportunities for growth, for improving the response, things that you're seeing.
So I know a call that King and I, we were actually requested by 2 other officers who were assisting a gentleman outside of the men's shelter. He was there for a couple of days. Yeah, and he was having some suicidal ideation, so we got him to the hospital safely. We were able to speak with him while we were transporting him just to see how we can better help his current situation.
I think the more that we ride, I've ridden with Kiata several times. We learn more about each other. We learn how each other operates. So that better helps when we go to calls together. Kind of learning from each other. So we're definitely more comfortable.
Absolutely.
The more days go by that we're together. So.
Durham is a champion in this. We're the first in a lot of things. I would love for us to be a model for other programs throughout the United States.
More people really should know more about the HEART program.
Yeah.
Because we were in the crisis, and you guys just lifted a heavy boulder off of us, and just have another choice.
They kept calling us and checking on us. All of it that I had built up in me from so much pressure and being homeless, I actually started crying, man, because I was so in pain. I was holding it for so long. I never knew you guys existed, and now it's I can actually give my resources out to other people. Call the HEART program because they'll help you.
My hope for the work that we're doing is that we will be able to expand throughout definitely the whole city of Durham and provide this to all city residents 24 hours a day, 7 days a week. Just like fire, EMS, and police have been adopted pretty much across the country, I would like the same thing for anyone to be able to have access to these resources and the responses that we provide, because I do believe it's the most appropriate.
We can't do this alone. It can't just be the safety program. It can't just be the police. It has to be all three areas: the community, the HEART program, and the police working together. Because you cannot handle this without everybody being at the table.
Where I'm sitting at today is the best thing I've ever done in my life. I love being on your team, and I really believe in this work, and I'm just excited for what together we can do to help reimagine some aspects of public safety. And you are part of the stories that are going to be written about us. So what I want you to do is to take one Post-it note, and I want you to think about this work 1 year from now. Think of a headline that you want to work toward, and let's put it on the wall beside the screen. There is no right or wrong headline here. Every one of these things is a real possibility a year from now. And they're a possibility a year from now because of what each of you will bring. It takes courage to be a first responder. It takes courage to walk into moments of crisis. And I just want to name that and lift up my appreciation for your compassion, for your courage, and that I'm so glad that you are now a part of our story. And I'm so excited to see where we're at a year from now because of the work that you and everyone else will bring.